Welcome, I'm Dr. Sherry Berger here this week for the Easy IM Update. Here's what's buzzing in the world of small animal internal medicine. I'm here with Dr. Elisabeth Zenger. Welcome, Dr. Zenger.
Thanks, Dr. Berger. So for this week's internal medicine buzz, I decided to select an article from the Journal of Veterinary Internal Medicine. It's called Pharmacokinetics of Total Thyroxine after repeated oral administration of levothyroxine solution and its clinical efficacy in hypothyroid dogs. So basically, they looked at the pharmacokinetics of thyroid supplementation in clinically affected dogs, which is really an important point in this paper. So by way of background, we know that hypothyroidism is one of the most, if not the most common endocrine disease in dogs, and it requires lifelong daily treatment. Owner compliance is often a common cause of treatment failure. So what I added as an important point for the background of this article is this is the only published controlled study examining the pharmacokinetics of levothyroxine in naturally, clinically affected dogs. And you've often heard me say, especially when I've given my talks about hypothyroidism, that there is no consensus on how to treat hypothyroid dogs. And I think part of the problem is we don't have, until this paper was published, we didn't really have that data. And oftentimes we get the experience of specialists saying, well, in my experience, dogs need this dose or whatever. But remember that specialists are often treating the most difficult and challenging cases. So this brings it back to the general population of dogs that are being seen in practice on a day-to-day basis. So the objectives of the study were to investigate the plasma profile and pharmacokinetics of total T4 after the oral administration of a T4 solution, and they also looked at the clinical efficacy, again, in hypothyroid dogs. So they used 10 dogs with naturally occurring hypothyroidism, and they had very stringent inclusion criteria. They actually had 12 dogs initially, and then 2 of the dogs didn't pass all of their testing. So not only did they look at T4s, they also looked at TSH, as well as doing thyroid scintigraphy. So very, very stringent inclusion criteria there. The methods, so after the diagnosis was made, they were supplemented with the solution orally once a day at 20 micrograms per kilogram of body weight for a minimum of 4 weeks. And then the plasma profile and the pharmacokinetics of T4 were determined over 34 hours, and they actually measured on an hourly basis. And they also investigated the clinical condition. Just like to point out that 20 micrograms per kilogram is similar to what we commonly consider a starting dose of 0.1 milligram per 10 pounds, which would be 22 micrograms per kilogram. So we tend to dose slightly higher than what they were doing as a starting dose. But the other important thing to note is that this is once a day dosing, not twice a day dosing. So the results, the median trough value, so this is before the pharmacokinetics were done, so the very first baseline before morning pill was approximately 23 nanomoles per liter, or 2.3 nanomoles per deciliter, and units we're more familiar with. So a good, healthy trough value. The Tmax is about 5 hours, and that matches up very nicely with what we tend to think of as the peak time, our 4 to 6 hour post pill, and it was 56 nanomoles or 5.6 nanomoles per deciliter. It's a little bit higher than I often like to see, but that was their mean for the Tmax or the peak value. Clinical signs improved or resolved in all dogs. This was after 4 weeks. Interestingly, activity improved within a week in all dogs. Dermatologic conditions actually were improving, but actually took much longer than 4 weeks to completely resolve. The dosage was determined to be appropriate in 5 dogs, so 50% of the dogs in this case. They didn't have to change the dose after the initial pharmacokinetics. 4 dogs required a slight increase, so about a 10% increase, and that matches up a little bit better with our 22 micrograms per kilogram, as I mentioned. And then 1 dog needed to go to twice-day dosing, and that was determined because he had a very, very short half-life. That would be really hard to determine in a clinical situation, and that might be a dog that you would get in your 4 to 6 hour for the measuring your T4 at the peak value, and he would have a very low, and then you would initially think, well, I need to raise the dose, but that might actually be a dog that needs twice-a-day dosing, and so that's going to be a little bit more challenging to determine based on the pharmacokinetics of this study. So the conclusions and the clinical importance of this. So we now know that the pharmacokinetics of T4 in hypothyroid dogs is similar to that reported in healthy euthyroid dogs. The clinical and hormonal responses to the T4 solution were rapid in all dogs. The starting dose of 20 micrograms per kilogram once a day was suitable for maintenance in 50% of the dogs, with minor modifications in the dosages for 4, and then twice-a-day dosing. It is really important to remember, though, that due to differences in absorption, metabolism, and the half-life between individuals, the optimum dose and frequency should be titrated to the individual patient. So once again, once-a-day dosing is probably appropriate, and we don't need to do twice-a-day dosing in the vast majority of dogs. I think the dogs that are not responding well perhaps need to go to twice-a-day dosing, but not all dogs need to start at that level. So that's what's buzzing in the internal medicine world today. So that's this week's Easy IM update.